Hello, it's Anthony Chadwick from the Webinar Vet, welcoming you to another episode of VETchat. And I'm so pleased today to be able to welcome Stacey Newton, who is the head of ClinPath at Nationwide Laboratories. Stacey, great to have you on the podcast.
Thank you very much, Anthony.
Stacey, just, obviously people may not know who you are who are listening. So just tell us a little bit about your background. Obviously you're a veterinarian, but if you can perhaps just tell us a little bit about your journey to how you found yourself as head of ClinPath at Nationwide.
So, I went to Bristol University, qualified from University of Bristol, 1993 it'll be. And then I went into practice for a bit, just a mixed practice. I managed to get myself a residency at the University of Liverpool in 1995, and that was in internal medicine. And I worked with Derek Nottenbelt and got my internal medicine certificate then, and then got funding for a PhD, which I started in 1998. And then when I qualified, I locumed for a bit, and then an opening up came in NWL, so it was Northwest Labs then, and they needed a pathologist. And so I started working there as a temporary position and stayed there. And then, of course, the lab was sold to DECRA for a while, for about 5 years they owned it, and then it was sold again to NVS a part of it, and then Patterson's now own us, which is an American company. But I've stayed there all, during this time. And during that time, I did my diploma from the Royal College of Pathology, and then of course they demolished that degree and said, oh, would that no longer exist? You have to do another exam. So I then went on to get my fellowship. So I'm a fellow of the Royal College of Pathologists.
Fantastic. Degrees of separation there. I actually met Derek in Zimbabwe when I was on an elective in, I think it was 88. And he was a lecturer over there, and then he came over to Liverpool. So by the time we started fourth year, sort of 3 or 4 months later, he was our lecturer. So great times at Liverpool. It was a really powerful equine department. But I suppose we should stop talking about that and maybe talk about, obviously, we want to talk about aging pets today. And that's partly because you've had this launch of the Aging Pet Diagnostic Resource Hub, which is there to offer practice tools and educational content. And you're also partnering with BSAVA for their PetSavers Aging Canine Toolkit as well. So maybe tell us a little bit about that first, and then I think it'd be great to talk a bit more practically about where you think we should be doing more testing, with our geriatric and our senior pets.
The BSAVA PetSavers, it's Aging Canine Toolkit. We basically just joined with them with respect to offering the pathology side of that. The original design of that was done by the University of Liverpool, with a couple of people that were working, investigating, and the problem of pets aging and owners' awareness of this, and also how the owners perceived it, as well as what the vets thought that was a problem. And they did a lot of investigation. They interviewed, as far as I know, vets and owners. They also sent out questionnaires, and they basically determined a whole lot of interesting things. That a lot of the main thing is that they found the owners don't really realize that some of the signs their pets are showing, are maybe, pathological, or may, indicate some underlying disease. They just think, oh, they're getting old. So, for example, a dog that they, used to love running around, they used to take for walks, now wants to sleep most of the time, or, it seems like it's not interested in decreased activity, that sort of thing. And they don't realize that there might be other things going on, and some of it is old age, obviously, but there's some changes that can be alleviated or sort of managed to help this pet sort of live into its older years in a comfortable sort of a comfortable way and position, and also so the owners still enjoy, both of them both enjoy life together, and that sort of thing. So there was a whole load of points that they decided were important, and that was makes it part of this toolkit, where they ask in the back of there's a big it's a big booklet, and it discusses all the different changes you might see in older animals, and it goes through those first, and then it has a list at the back, which it repeats for them to make, for the owners to make checklists and look and see, does your pet show this, this, and this? And if there any, and they have like a traffic light system, they have green, amber, and red, and anything that they tick as amber or red, they need to really maybe talk to the vet about. And it was also to try and get the owners maybe to interact and bring with the vets and bring the pets more often to the vets to be examined, because I think they found quite a lot of owners with older animals thought, they no longer had them vaccinated after a while because they thought they didn't need it, so they weren't presenting them to the vet on a regular basis to be checked out. And then there was just, and the vets were also, they'd come when eventually the owner would come with a, bring their pet to the vet and say, hey, it's doing this, look at this. And by that time, by that time maybe they had really progressive osteoarthritis or something like that, and the vets would say, well, there's nothing I can do, or what I mean, if you'd brought it a lot earlier, maybe we could have done this, this, and this sort of thing. And I think the vets were getting frustrated that
Yeah.
things weren't being done early enough, and maybe they could have just made everything, just progressed it in a, I don't know, in a better way that help both the owner and the pet. Because as pets get older, they change in how they're acting and what they can do. And sometimes it's almost like the owners it's like having another person or animal or something to care for. Do you know what I
Mm.
mean? Like you become a carer sort of thing. So it's more to get the owners clued up as well, as where they
Yeah.
could do something for their pet, and also just have a better interaction, and so they can help their pets and the vets can help the owners and that sort of thing. Do you know what I mean? It's just
Yeah.
that's what they were investigating. And so they designed this toolkit where they'd hand out to the owners. This is what they only launched it this year, but they don't know exactly what I think they're aiming to do with it as such. They've launched it, and the vets have access to it. I know the owners can get access to it. They can go on our website and get access to it. And I think they were suggesting the vets put posters and stuff like that in the waiting room, and so clients could have a look, and then just be more aware of clinical signs and stuff that
Mm.
might suggest to them, well, no, this isn't just a normal change. It might be something some underlying disease, which we can also deal with. So, because a lot of the changes that animals show when they get old can also be due to underlying pathology, like maybe kidney disease, or, obviously I mentioned osteoarthritis, which is quite common in older animals, and some of the endocrinopathies you get in dogs, that sort of thing.
I think it's frustrating when, for me, when I was in practice, when I'd have a moribund cat delivered to the consulting room and it was put on the table and it was as flat as a fluke. It was very skinny, cachexic. And they said, I didn't want to bring it in sooner because I knew you'd put it to sleep. And you went, well, you've given me no choice. I think
Mm,
sometimes, as you said, maybe clients don't know what we're capable of doing. This was probably a cat that maybe had a hypothyroid or kidney disease. And had we got it on relevant treatment earlier, we
hmm
probably could have extended its life and its quality of life, which I think is a really important part of that whole equation that you're talking about there, isn't it?
yeah. I think they also found that a lot of the owners were afraid to bring their pets in because they thought, I'm not going to come back with my pet. They're going to they're going to put it to sleep then and there. And the vets wanted to communicate that that wasn't going to happen. They wouldn't, you know what I mean? In most cases, you know what I mean? They
Yeah,
need to, and also just also chat to the vet if you think, get them to come in and actually just chat. I mean, I know that's difficult to say, but they were just trying to get them to come in a bit more often, so to prevent this happening. You just end up at there's I mean, obviously ultimately you may have to put it down, but a lot of the owners didn't want to come in because they just thought, I'm just
yeah.
not going to come back with my pet. So
I think that was the thing, and obviously then when it comes in, collapsed on the table, there's no choice, but they leave it and they leave it and they leave it, and of course that's not fair on the animals. So it's an education piece for
mm,
the clients as well, that they've got to look after the welfare of the animal. Just obviously because things change and so on. We used to talk about 7 years equated to 1 year in an animal, into a human was cats and dogs. I think that's changed a little bit, hasn't it? So where do you now place the marker for a senior pet? Obviously, I know it may differ from size of pet and so on, but have you got any sort of rules? Has anything changed on that over the last few years? How would you class a geriatric cat and dog?
So, I mean, there's various classifications that everybody's looked at and to try and make this a bit more sort of clear, but it does vary. It in dogs in particular, it does depend on the size.
Yeah,
So larger dogs or larger dog breeds as well, they age quicker than the smaller dogs. So sort of an age of about maybe 7 is probably senior for a large breed, whereas in a smaller breed it may be like 10 or
yeah,
or even older. So it does, and one of the sort of recommend or some of the guidelines that various institutions have suggested doing a cutoff of weight and trying to do it as aging based on weight. I don't know the exact cutoff, but they do mention it. The people that did the study at University of Liverpool for this canine
mm,
aging mentioned a cutoff of about 27 kilos, I think. Less than
yeah.
that was classed as small. Greater than that, you'd class them as large. But I mean, that's not necessarily fits with everything.
30 feels about right, doesn't it, as large and small dog? You know, 30
Yeah.
kilograms above is what you would class as a large dog, I suppose.
Yeah, exactly. And then one of the American hospital, the AAA, the American Veterinary sort of AAHA hospital,
Yeah,
divine guidelines, which suggested with dogs that they said that in the senior was when they were in the last 25% of their estimated lifespan. So
yeah,
again, that's going to depend on breed, size,
yeah.
etc.
What the average age is.
Moving on to cats, though, they are more uniform, particularly in size, and therefore they don't really have this size related issue. And then, so we look at sort of, I think older cats, we're looking at sort of senior are probably greater than 10 years of age. And then we talk about the various little phrases, different guidelines suggest to talk about super senior when they're 14 and over, that sort of thing. But the geriatric word is interesting because geriatric, I've never really used that, but some of the studies suggest that geriatric really shouldn't be used for age. It's more like a health status rather than
Right.
an older thing. So, because geriatric to me sounds like, oh, if you were talking about a human, you were, I don't know, greater than 90 or something. Do you know what I mean?
And
So
coming to your
again,
end.
so in when we say geriatric, I think it's more health status rather than
Yeah.
actually, sort of using it for aging.
A lot of sort of recognition now of the DNA and our genome and things. Have we found markers, biomarkers in dogs and cats that kind of might be able to help predict age or longevity?
Yeah, I think at the moment, I mean, they're investigating all of these, but at the moment they don't have any particular markers to suggest the actual age like they do in, I mean, I don't know what they use in humans, but they don't have anything particular with cats and dogs.
Mm,
Not at this moment anyway. I mean, they're
yeah,
still working on it. There's I don't know, there's a lot of work also with cognitive function in both cats and dogs that they're looking at. So, they may develop markers with respect to that.
I know Danielle Gunmore's husband is an expert on. He's doing work on Alzheimer's in dolphins and so on, and it obviously is looking for those sort of markers as well. But I suppose that's pathological. That's kind of more from
Mm,
tissue rather than blood and things. I used to do a lot of testing on older dogs and cats. They'd come in at 7 and 8, and I'd start saying, it's worth just doing a health profile, looking, depending on obviously the species, but cats, looking at kidneys, looking at thyroid levels. Similarly, in the dog, looking at general kidney and liver, and then maybe even thyroid again,
hmm
depending on how the pet was. But obviously thyroid, particularly in dogs, is difficult to interpret, isn't it? So what would you be suggesting now from the perspective of senior pet health clinics? When would you be recommending blood samples? Is a urine sample a good first point just to kind of get a baseline? What kind of is going on in practice now for this sort of senior blood testing and urine testing and so on?
So I'm not sure what exactly everybody's doing in practice currently, but the recommendation is when they get to the senior age, and actually some I've talked to other vets recently from very not just this country but very across in the States and stuff, and they suggest really. that from day one, so when the pet comes in, I'm not saying when they're a puppy, but when they come in, from from when they're young, that when they reach adult, well, adult stage, young adult stage, that they have blood samples taken then, so we have a baseline for that individual. And then technically they do advise that every year you should have a sort of just a monitoring blood sample, do hematology and biochemistry. But a lot of the references suggest that shouldn't start till they're older. So we're talking about probably 7 years of age or older,
Yeah,
say for I don't know, a small dog, or even I suppose other sources suggest it should be younger. There's a disagreement between different people, but I think if you have a baseline for an individual, because you have to remember that these all the reference intervals that are designed, they're not for the entire population. They're sort of, you use this bell
yeah,
curve of 90% of the 95% of the population, and therefore you're always going to get a few that are outside of that. Particularly with having a baseline, you can use parameters like creatinine, which are very insensitive in determining what's going on with the kidney, but you can actually monitor levels, and see if they're increasing over a period of time. Then it does suggest that there's probably being loss of renal tubules in the kidney, though you're not seeing any clinical signs, you're not seeing any change in USG, there's still normal concentrating ability. So I think once they get aged, then so a senior pet probably should have it every year. But then when you start to get older pets, so we're looking at maybe cats, cats over 14, dogs over 10, they're talking about maybe every 6 months. And a urinalysis, I think, is always important, because it's if the owner can collect a urine and bring it in with them, it's easy just to dipstick it. I mean, obviously you can do sediment as well, but I think that's quite a important tool to look at. I mean, they do it with humans all the time. They always say, if you're, you know, can we have a urine sample as well? If there's
yeah.
something they think there's unwell. But yes, I think that's important.
As you said, it's difficult because we can lose, a kidney and a half and still cope, and it's that kind of where we fall off the cliff and suddenly we decompensate. So, for people who perhaps got, blood samples from a cat, kidney function looks abnormal, but the cat is still doing well, still drinking, etc. What sort of advice are you giving in those sort of cases where you can obviously see age-related changes, but they're not actually causing any clinical problems?
Yeah, I mean that depends. You see, if we can determine changes early, then you can then alter. We can look at, maybe do we need to do some dietary, modifications to help the kidneys. There's actually a more recent test that IDEX designed, which is, I think it's FG, I can't remember the exact, 23, which was looking at, it's related to phosphorus levels that increase due to the decrease in GFR as you get decreased kidney function. And they suggested using this test for early detection of increased phosphorus retention, and therefore putting, so early stage renal disease, possibly where they're not really showing much, or any clinical signs. You could then use maybe phosphorus restriction or some change in the diet. So yeah, there's various parameters you can use to determine, whether you need to intervene in that stage.
I think I remember a study, I think it might have been in JSAP a long, long time ago, just showing putting a cat on a kidney diet would double their life expectancy compared with a control group. So
Mm.
diet is massive in things like kidney disease, isn't it?
It is that, but then you get this argument from owners as well, saying if I change the diet, they're not going to eat it. I mean,
Mm,
cats are more
more
fastidious than
fastidious.
dogs, but you will. I think you should always try. I don't think
Yeah.
they should just have the mindset that cats aren't going to want to eat any special diet, because some of them will. And yes, it does. I think it has probably a huge benefit.
I had a cat who adopted me during the pandemic called Buddy. He's 19, so I think he's super, super senior. I
Yes.
do a blood sample every year with him, and his kidneys are still really normal, and he's not fastidious in his eating. So he kind of sits by the cupboard and says, in no uncertain terms, "I need to be fed now," with his vocalization. So he makes his will very clear. As you get older, obviously, your parameters do shift a bit. How do we interpret that, as just an old age change or a clinical change, as pets get older?
Yeah, I mean, there's various parameters that will change as you get older. I mean, and that includes, if we're talking about blood, hematology, and biochemistry, there are things that do change. For example, in the hemogram, you might get the white cells become lower in number. The In biochemistry, if the animal is if they lose any muscle mass or anything, the creatinine actually can decrease, and therefore that can hide any sort of change in renal parameters. So they then start to just using SDMA, which is another marker of kidney function, which is supposed to be more sensitive. But also, as dogs age, the thyroid also becomes sort of less active. The T4s will lower, and you
Yeah.
can get low normal or slightly low T4s in older dogs that are perfectly normal. But then if you get persistently or particularly low T4s, that obviously can indicate other illness that's going on and affecting the thyroid. But yeah, there's a few changes that do occur. But if you have anything that's, if we're looking at, so for example, liver and kidney parameters, and you have them outside of the reference range, I think you should always,
Take them
consider
seriously.
them as possible pathology there. Yeah, not just say, oh, because you do see elevated AP in dogs in some cases, which have a benign nodular regenerative
Mm.
hyperplasia, and that's fine. That might be the case, but it could also indicate other things. You could have other endocrinopathies, could have possibly cholestatic disease. I mean, obviously bilirubin's usually increased with that, but there's other causes of that. But I mean, it probably should be, if the animal is perfectly well at that time, for example, and you only saw AP elevated on a mildly elevated on a profile, you probably, okay, that's probably not of consequence.
Yeah.
Obviously, check it wasn't on any drug therapy that might be affecting it, including steroids, and then you could monitor it. But I mean, it just depends on what's up. We tend to, in other parameters, I say, we tend to consider them of possible significance, even if they're
I
older.
think alkalos is an interesting one because it's not very specific, is it? So there's
No.
so many things that can cause a raise, like you said, with steroid tablets. So I used to see a lot of those with my dermatology cases that had been on steroids for a while, and the alk phos would go up. But I do like the idea of taking a sample from each pet, when it's 1 year old, because
Mm.
that does give you the baseline and it helps you to become a lot more personalized in your medicine towards that animal, and doesn't it, rather than have these kind of reference ranges, which by their nature are obviously an average of a large number of pets, aren't they?
Yeah, I think that's important, which I don't think a lot of people are doing that. And obviously, it's an added expense to the owner, but I think it would be very helpful for when the patient then eventually possibly becomes ill later on, that you have this baseline, and to compare
Yeah.
back to. I mean, particularly creatinine, the reference interval for that is just, there's not really a known proper reference interval that at all, and it does vary between different species in dogs. Obviously um, and it's definitely affected by muscle mass. It's compared. So, for example, you get younger animals that have lower muscle mass, they have lower creatinine. This could also occur in an aging animal that's lost muscle, but then you get in between. You get, for example, greyhounds often have high creatinines.
Yeah.
That don't necessarily mean it's got renal disease, so that sort of thing. And talking about AP and some of the liver enzymes, they do vary between breeds as well. So
Yeah.
if we could have breed related reference intervals, that'd be brilliant. But at the moment, we're not really in that sort of stage. We
Yeah.
do have reference intervals for greyhounds, which we then sometimes class some of the other sighthounds in with that, but we don't have any other breed related reference intervals.
There sounds like there's a lot of information that we can still collect together, but actually the new nationwide aging pet diagnostics resource seems like a really interesting place to go and have a look for that. And presumably any vet can use that. And I think you said clients can also go on
Yeah,
to
they can.
part of this.
Yes, as far as I can see, because I was looking at this the other day, they can go on it. It's free access as far as I know. If you go on the Nationwide Laboratories website, you can
Yeah.
get onto those sort of resources. And we have a handbook of, you know, various tests and stuff like that and conditions, which again, as far as I know, is free access. Even vets, mainly vets, really to look at.
Where do you see the whole sort of senior testing and senior medicine moving forward in the next 5 to 10 years? Just to finish off, Stacey.
I think we're probably trying to move towards what the human side is doing, where they're trying to, we're obviously doing monitoring of various parameters in hemogram and biochemistry, but they're also trying to do profiling, DNA profiling and stuff like that, and determine other markers that might indicate, you might have, I don't know, developing, I mean, particularly on the human side, possibly neoplasia or something like that, but also they have markers that they're looking at with respect to osteoarthritis and things that they could use for a specific individual to target
Mm.
certain conditions. I think that's probably moving towards that. And also there's going to be I think probably a lot more use. I don't know if it's really gone back to that, but I think a lot more use of telemedicine and trying, remote consults and things like that to try and communicate more with between vets and clients.
Yeah. No, it's a fascinating area, and I think we perhaps still don't put the amount of time into those older pets that we should. Continuing to get them in. I think there is a drop off. You vaccinate an animal, quite a few come back for the first booster,
Mm.
but it is a good way of us keeping an eye on our pets and hopefully giving them, longer life as well by watching out for these conditions like kidney disease in cats and thyroid disease early when we can make a big difference.
Yeah, I think if we can let the owners know what sort of things may develop in their pets as they get older, then they'd probably be more inclined to bring them to the vet saying, "Oh, I've seen this and I think this might be happening," and therefore you could then, get an individual treated early on before you get to the stage where there's nothing else you can do with it. I
Yeah,
just think they need to be a bit more maybe aware of that and not just assume their pet's old and then just, that's it, it's old, we're not going to do anything, with it, when maybe they could make its life definitely more comfortable
yeah,
anyway, but also longer, and then they can both enjoy each other's company.
yeah. There's so much that we can now do, and it is communicating that over to the client as well, isn't it? So,
Mm.
yeah. Listen, Stacey, thank you so much, and really interesting to see this new resource. We will obviously put that underneath the podcast for people who are interested, but it's basically nwlabs.co.uk/aging hyphen pet hyphen diagnostics.
Yeah.
But that will go underneath on the podcast for people to go and have a look at it. I think it's well worth to go and have a nose, and hopefully it'll help you as a vet just to give better advice to these older pets so that people can keep them for longer. And as Stacey said, have more time and more quality of life with them as well. So, Stacey, thank you so much for agreeing to come on, and obviously, thanks to Nationwide Labs for sponsoring this podcast.
That's okay. Thank you very much, Anthony, and it was great to talk to you.
Thanks, Stacey. Take care. Bye bye. And thanks everyone for listening. See you on a podcast or a webinar very soon.